Not getting your health and wellness questions answered at your doctor's office? Are you ready to take control of your health and well-being? Do you want the proper tools to set you on your wellness journey? Do you want to meet and chat with expert members of the healthcare team? Well, step into real time with Dr. Stacey. Hi, I'm Dr. Stacey DeGale, your personal physiotherapist and wellness consultant who wants to make sure that you live your best life. We'll be chatting with wellness team members and inviting you as you are the center of that team. And we'll be doing all of this while you are in the comfort of your own home or office. Join me in real time with Dr. Stacey as we discuss everything health and everything wellness. Oh my gosh, good afternoon, everyone. It is such a pleasure to be back. I know I've been away for a while, but you know how things go. Life is lifing, but I am here and happy that you could join me. For those already on, welcome and feel free to share this live. You're going to get information that is going to change your lives for the better. Tonight's topic, or this evening's topic, is one that affects every family, because whether you're a wife, daughter, mother, sister, friend, or colleague, we all know a man we care deeply about. And I'm, a little biased. I decided to pick on our ladies because sometimes we are the ones who have to drive the health decisions of our men. But I trust that after this conversation, men, you would take up the mantle and take those first and second steps to get you on your health and wellness journey. Our discussion today is called Real Men, Real Health, Real Conversations. And this evening we are focusing on the silent killers affecting men. For so long, and I mentioned it on my message to you this morning, we have so many men who are appearing healthy on the outside, yet they are walking around with dangerously high blood pressure levels, dangerously high sugar levels, early heart disease, people dropping down, boop, no warning, and we're wondering why. This is your opportunity to learn the whys and learn how to prevent untimely death and untimely disability. Joining me this evening is someone who works with men every day. I used the young people term this morning, who works with men on a daily and who understands these issues firsthand. So, ladies and gents, help me to welcome Dr. Saniv Pararam, our primary care and specialist occupational physician. Good afternoon, Doc.
Good afternoon, Stacey. Good afternoon, Trinidad and Tobago. I am so happy to be here. Thank you for the invite, and I'm ready to go.
We're raring to go, and we have a lot to cover. But as I always emphasize to my audience, that quite often we feel that we have to fly out from Trinidad to get information, to get expertise, to get proper health care, and we don't. I think sometimes we are not true to ourselves and we don't elevate our healthcare team well enough. And you gave me a bio and you told me to edit it. But I found it difficult to really edit because I think people need to get to know you a little better and to understand why I asked you to be my first guest. So I know you may not want to hear, but I want the audience to hear. So guys, Dr. Pararam is one of our esteemed medical experts who graduated from the Faculty of Medical Sciences at Mount Hope a few years ago, 2005. And he has spent most of his 20-plus career in the community as a primary care physician, where he focused on public health, family medicine, and health promotion. Again, That's one of the main reasons why I wanted him to be our first guest. He has a postgraduate diploma from the Faculty of Medical Sciences Department in Primary Care and Public Health with distinction. He, Dr. Pararam is always humble, he's down to earth, but the man knows his stuff. He holds a master's degree with honors from the University of Manchester in occupational and environmental medicine, and he has more than 13 years of clinical experience in the field. Now, while he was a senior primary care physician and DMO in the public sector, he functioned as the incident commander for COVID-19 response for his county and was also the medical director for the Ministry of Health and Swaro Home of Football COVID-19 step-down facility. In his private capacity as an occupational physician, he has assisted companies to manage their response to outbreaks such as Ebola, influenza, swine flu, COVID, and all the rest. He has also functioned as the medical director of the Atto Bolden mass COVID-19 vaccination site. Listen, he is presently the chief medical advisor at Chandelier Occupational Medical Associates, where he continues to offer guidance and leadership to multiple companies on a wide range of medical and occupational health topics. So guys, you understand better now why I asked Dr. Pararam to be with us, because he has a working knowledge and practical. It's not about sitting behind a desk, guys, and just giving instructions to patients. No, he is also male. He understands the male persuasion, and he works with men in different capacities. So again, we welcome him to our show. So I want to get into it one time, and I'm going to be a little biased there as the host now. I can take a little umbrage. And let me ask you, in your experience, who is it harder to convince to come to the doctor? A child or a man?
Oh, men, easily, men. Yeah, Trinidad men. I mean, it's global, but I mean, Trinidad men, yeah, them healthy, them good. Nothing wrong with them. They may come into the doctor.
Why do you think? Why do you think so many men wait until something is seriously wrong before they visit the doctor?
I mean, it has to do a lot in how men are raised, and they're taught to be stoic. They're taught to not complain, don't cry, don't say this is wrong, that is wrong. Grind and go through your day. Don't complain, and I guess it just, I mean, like, I think it's global, but I really think in Trinidad it's particular. That you're just supposed to grin and bear it and move forward with your day. And it's just something that we call it in the field health-seeking behavior. The health-seeking behavior of men is not good in Trinidad.
Yeah. And it shows how culture is really impactful, because I still hear, because I have no children of my own, but I have 7 godchildren, and I'm around children. I work with children, and you hear the parents say, "Why are you crying, your boy? Boys don't cry," and those sorts of things. So for our viewers, we have to learn from now that how we approach the raising of our children impacts the health decisions that they ultimately make. Yeah.
Very much so. Yeah.
So one of the questions actually a patient asked today when they said they were going to come on to the show today, and they asked me, Stacey, you think men are actually getting sicker, or because we have social media, we're hearing about it more? What do you think, Doc?
So I think it's both, really. They are getting sicker because I think society and the environment and the kinds of foods out there are not as healthy as they used to be. So when I was growing up in the 80s, you go to a grocery, you don't see plastic packaging. Now plastic is everywhere, microplastics all over, nanoplastics all over. Those things are linked now to heart disease and early heart disease and earlier cancers, so it's partially because of the environment becoming more and more unhealthy, I think.
Yeah.
So yes, they are becoming sicker earlier. It's also because of our society is moving away from, long ago they used to call it an agrarian society where everyone has to either agriculture based or so. Now we are sedentary society. So we still like the foods we like to eat. but we're not moving as much. So
Correct.
so things are, developing much earlier. Things that you would
Yeah.
have seen in the 50s and the 60s long ago, people developing these things, even in the teenage years.
Yeah.
So the so-called
Very.
chronic non-communicable diseases like diabetes and heart disease
Yeah.
showing up a lot earlier. So yeah, they are sicker. The problem with when you use the term sicker, it kind of feeds into that culture where men believe only when I feel sick I should come for help.
Mm-hmm.
And
Mm-hmm.
that's what we want to move away from, because most of these diseases will have signs that we could measure and we could pick up if you come for checkups regularly long before you get symptoms. So we do
Yes.
not want to wait for symptoms, right? The absence of disease um really is something that people associate with the absence of symptoms, and they're not the same thing, they're not the same thing.
So you said it, the increased number of NCDs, non-communicable diseases, and we
Hmm.
saw it
Hmm.
especially during COVID. Even in children, we have a large number of children now who, between, I'm talking about 10 to 16 years old, who are now type 2 diabetics,
Yeah.
who we picked up during COVID-19 because they were home, not moving, people are afraid to go out. COVID is over, but we have still maintained this sedentary sort of living. And as
Yeah.
you rightly said, the term of the word, the use of the word sicker denotes that I have to feel sick before I get to the
Hmm.
doctor to do the checkups. And this
Yeah.
is why this first episode of Real Men, Real Health, Real Conversations is focusing on those silent killers. What do you consider to be some of the silent killers, the main silent killers affecting men in particular?
Most of these chronic non-communicable diseases, they still are the number one, two, three, four top killers of men. So when you look at cardiovascular disease, the signs that we could pick up in the medical field of cardiovascular disease developing in men um, happen many, many years before you get symptoms. Many
Mm-hmm.
years, right? But the man will feel, well, I don't have symptoms, and therefore I must be healthy. And that's just not the case. Health is not the absence of a disease or a sickness. Health is far more than that. So if you, just because you don't have a symptom of something doesn't mean you are
Yes.
healthy. So there are too many, of these chronic diseases that are silent because you're not going to feel symptoms. So sometimes with the employees that I work with in companies, the companies will do annual medicals,
Yes.
and they will do blood sugar tests, depending on their budget, or cholesterol tests. And these things, when you see someone with high cholesterol and you pick it up, and they say, Doc, how is my cholesterol so high?
Mm-hmm.
And they can't believe it. They say, Doc, well, why wasn't I feeling something? Well, high cholesterol doesn't have a symptom,
That's right.
but we could pick it up in a blood test, and then we can help you understand your risk. You know,
Yes.
yeah. So most of these chronic diseases are silent until it's too late.
Until it's too late. And
Yeah.
this is one of the reasons why hypertension, for example,
Mm.
literally is called a silent killer.
That's the classic one. Yeah, that's the classic one.
Because
So I have so many patients walking around with blood pressures 210 over 120, and they have no symptoms. You know, and we believe that God put a blood pressure machine in our neck. So
yes, oh my
only
God.
when your neck hurting, you go marry doctor. No, most of the time when your neck hurting is because you slept bad or something.
Correct.
Yeah. So hypertension is a classic one, really, of being a silent killer.
What damage is happening in the body? I think people are not grasping the impact of hypertension on the body.
Yeah.
What is happening in the body when we are experiencing high blood pressure?
So our vascular system, basically, you might think of the pipes in your home, right? So basically, it's just a hydraulic system, right? And it's lined with a layer of cells that we call the endothelium. And the endothelium, Stacey, you there?
Yes.
Right, yeah. So the endothelium is this highly specific sort of a monitoring system that we have in place. It monitors blood pressure. It monitors a lot of different parameters in your blood. And when you have hypertension now, your blood vessels start to expand because it's dealing with a high pressure. And that delicate inner lining now is damaged in some way, and that causes inflammation. It causes the body to activate all sorts of repair mechanisms to try and fix that little damage and little micro tears that you form. You don't feel any of that happening, but one of the ways the body will deal with that is recruit LDL, what we call bad cholesterol. And just like if you watch a guy plastering a wall, a crack on a wall, you slap something there,
Hmm.
and then you become, that becomes a fatty streak. And if it keeps happening, that fatty sheet grows and becomes a plaque, and that's silent. There's no symptom of that,
None.
you know? Yeah. And then the high
What?
pressure by itself could damage, fine blood vessels and cause
Correct.
bleeding and damage your kidney and all of that. And again, you
That's
don't
right.
feel that until it's too late. Yeah.
And this is why we're having more and more patients entering into dialysis.
Mm-hmm.
Majority is that combination of uncontrolled diabetes and hypertension that
Control. And that's the key because many people, I mean, again, they're silent. So you have diabetes or hypertension for many years and you don't know. And then even when you get it, you don't feel sick, so therefore you're not really seeing about yourself or eating well, exercising,
right,
taking your medications, and therefore it becomes uncontrolled. And by the time 15, 20 years passes, your body says, it's trouble, I've had enough.
had enough, had
And then
enough.
and then you're so sick at that point, they kind of blame the dialysis and say, oh, when the dialysis killed my friend, and it's not that.
Yes.
Your body has been beaten down after 20 years of multiple chronic diseases that are not managed, and it's just difficult now for it to cope. Yeah.
I had a friend, it'll be 2 years now, about 2 years, 45 years old, suffered a mild stroke 2 years before, along with a heart attack, and then died 2 years ago, massive stroke, 45. And again, believing, well, I had medication to take, well, I'm not feeling anything, I good.
Yeah.
Not eating well, not sleeping, because when you come from work, you're going online, you're gymming, but you're drinking, punching right after, punching and Red Bull. And this is our culture. And we, for some reason, we are accepting it, and we're not shaking up ourselves. And someone mentioned on a chat that I was in, they show us the jab, and we're blaming everything on COVID-19.
That jab, that for the next 50 years, that jab caused everything. That,
yeah. And we could be more in control.
We don't. It's part of human nature, I suppose, in the psychology of humans, that they would prefer to blame something that maybe they felt they didn't have some sort of control of. So I remember, for example, I had to do a lecture for a company about some carcinogens or compounds that may be carcinogens, right? And in given context to them, first I'd quantify the exposure to the carcinogen in their job and all of that. But in given context, you would speak about alcohol. And alcohol is a grade 1 carcinogen, which is the worst kind of carcinogen, right? People didn't want to hear that. They were offended. They said, Doc, you shouldn't tell me about what I do in my private time. But I said, if you spend less than 20% of your time in work and 80% of your time outside work, and alcohol is one of your key habits, then yeah, it is my business as a medical provider to give you the best advice.
That's right.
Alcohol is a grade 1 carcinogen. So you have to understand and be accountable for it. I'm not saying don't ever drink alcohol, but be aware. That's the same kind of carcinogen as cigarette smoke. It's a highly carcinogenic compound. So
I have one of our viewers here sharing her a little experience she had with her husband. And Val, thanks for tuning in. Thanks so much and for commenting. And anybody else, feel free to comment and ask questions. And she said, so true, because her husband had her rubbing his back for a long time, thinking he strained his back, when in fact it was prostate cancer that was creeping in. So by the time he was diagnosed, he was late stage. It was more palliative.
Prostate cancer is one of the slowest growing cancers. So if men would just do the screening, you pick it up early and you cure that, right? And if you wait for symptoms of prostate cancer, well, yes. It's one of it's the easiest one to cure if you could pick it up early, and it's not hard to pick up, but when at that point, it's trouble. But it's indicative of the nature of men in Trinidad, where they will grind with all sorts of pain and say, are good. And they will not check. I don't know if some of them are just scared to find out exactly what is wrong. That's part of it in some. But the only way, too many of these things are silent, and the only way is to go and get your checkups regularly. That's the only way.
So when we're talking about, I'll just go back a little to the high blood pressure. If I am not feeling anything, what would you advise a man as to how often they should have their checkups, especially when it comes to high blood pressure? And some people, everybody has a blood pressure machine at home. To give them an idea of what good numbers are. I had a patient who said, Mr.
Mhm.
Again, my pressure not too high, it's 160 over 100 today. Good. And I
So
had to pause for a cause.
long ago they would have done studies that showed that as you age, your pressure goes up,
Yeah.
slowly, right? And that was interpreted as being normal.
Mm-hmm.
But studies then showed that the reason why older people get more strokes and get more heart attacks and more kidney problems is because of that pressure going up.
Mm-hmm.
So now we've realized that we're not supposed to sit there and just let it go up as you get older.
Yes.
We want you to get that young boy pressure and maintain that young boy and young girl pressure, you know? So I'm glad when I could have people with a young boy pressure. And that young boy pressure is 120 over 80. And
Yes.
once you start to regularly be higher than that into the 130s and 140s, then you're becoming hypertensive,
Yes.
So for people, even in their 20s, I would say, especially if you have a family history, okay, if you have access to a machine, you can Google how to do a resting blood pressure. I don't want to go into the details now because
Mm-hmm.
it may take long, but there's a way to check your blood pressure. It's called a resting blood pressure. It's how you
Mm-hmm.
sit and all of that. You don't
Yes.
want to just walk off the road and then go and do your blood pressure. It's not going to be accurate. So you can do that once. If you've never done it before, I would recommend maybe for once or twice a week for a few weeks you do it and just get an idea different times of the day what your readings
Right.
are. And if your readings are not 120, 80, or even a little bit less, because younger people actually will have it less, um,
Yes.
110, 70, that sort of thing. If you are seeing 130s or high 120s, then you probably need to do it more regularly and go to a doctor and maybe write down a blood pressure diary. And then they will
Right.
help you figure out how significant it is. Um, Most of the times, if we could get you to lose 10 pounds of weight or
Yes.
eat better and exercise, we don't need to put you on a tablet. We don't want to put you on a
That's right.
tablet. Although we sometimes get a bad reputation and as if doctors only want to go tablets. We don't want to
Mm-hmm.
do that all the time. It's just sometimes the discipline required to
Yes.
drop the weight and to eat healthy and avoid too much of the doubles or fried chicken or whatever. We know it's harder to do that. We don't have a lot of discipline in Trinidad. We like our belly.
Mm-hmm.
And sometimes, as doctors, we don't have a choice. We may give them a chance to
Hmm.
drop the weight, to eat better, and
Yeah.
3 to 6 months later, the problem is still there. And then we're not going to leave them with their high blood pressure or their high sugar. We're going to treat it. You
Yeah.
know.
And one of the, you mentioned the eating, and this is not just for the hypertension, this is for the diabetes, which we're going to talk about as
Hmm.
well, because we
Yeah.
have an increasing number of person becoming diabetic, a lot of whom are men. And I remember one of my physio colleagues in Japan said, Stacey, in Japan, their culture is that you eat until you're 80% full.
Correct. Yeah.
That's it's not just about what's on the plates, and that's a culture that they
Right.
develop, and that's why they develop the bento box, because it manages your portion control without you even thinking about it. So just as with hypertension, and I want to just talk about diabetes, what are some of the complications that worry you the most, especially for men who may be living with diabetes or
Mm.
are pre-diabetic and have no idea that they are?
Yeah. So I mean, diabetes again is one of those silent ones. And as you mentioned, Japan, right? So Japan culture is the 80%. Our culture is better man belly bust than good food don't go to waste, right? That's that culture. So that's the exact opposite, right? Now, when you have an excess of calories and now we're not active like we used to be, that leads to weight gain, especially weight gain
Yes.
around your waist, right? And that basically predisposes you to diabetes and other chronic diseases.
Yes.
And in the initial stages, there are no major symptoms. So the
Correct.
things that we speak about, like going blind with diabetes, having your limb cut off, those are the very end. That's the very end of the line. You
Yes.
probably have diabetes 20, 25, 30 years, very poorly controlled by the time you
Hmm.
get there, you
And
know?
clueless.
Yeah, and clueless. So if you wait to that point, then there's not much we could do,
Yeah.
other than maybe try to stop where it's at. So when you're looking at prevention of diabetes, it really should start in kids. Yeah? That kids need to know how to eat, how to exercise, that sort of thing.
Yes.
Um, it's difficult how to do that in Trinidad, I suppose, and even in Caribbean. But it's something we have to look at from that perspective.
Perspective.
That eating culture that we tend to have. You want your children to eat. We like our children looking fat, right? They're looking fat
Yeah.
and healthy,
When you
and
have to healthy.
yeah, and
Yeah.
that's not healthy, you know.
Yeah.
Um,
Hmm.
and it's part of our culture too. I mean, we've grown up hearing of grandparents and great grandparents where they went through the war and they had, famine. So therefore, it's a success that your child or your grandchild could be
Yes.
well fed. But now it borders on a kind of abuse. If you overfeed your children,
Yeah.
that's a type of abuse. So eating is important. I mean, we are what we eat. And when you eat a lot of refined carbs that are calorie dense but nutrient
Mhm.
poor, when you eat a lot of high saturated fat foods, those are the things that lead to diabetes and lead to being
Yes.
obese and lead to all the other things as you go down the road. Diabetes itself, I mean, we've been treating diabetes as the same as heart disease now. So if I diagnose someone with diabetes, in my head, I have diagnosed with heart disease as well because they're
Well,
twins. They're twins, right? And
yes.
therefore, we will put diabetics on a cholesterol medication because we have to be a
Hmm.
little more aggressive. We can't rely on this diabetes, to alone just to manage their cholesterol.
Yes.
It changes the equation. So diabetes, hypertension, all of this is linked into this phenomenon called a metabolic syndrome that we could always speak up
Mhm.
later. They're all linked.
It's really, I'm really happy to hear a doctor talking about movements, and you've mentioned it a
Mhm.
couple of times already, the
Yeah.
importance of movement in managing these non-communicable diseases, because you know in our profession, sometimes we have so many patients to see, and that education part is sometimes missing
Mhm.
because of the number of patients we
Correct.
have per
Yeah.
day.
Yeah.
And
It's like,
so I'm so happy that you mentioned over and over, because we like the quick fix. It is not
yeah.
a pill. If we get movement as part of our culture from childhood,
Mhm.
and children, for those listening, if you have a child, they should be exercising at least 1 hour per day. We
Yeah.
can't have children behind screens only anymore. What about
Yes.
the hopscotch? We play hopscotch and we did well in school. We played moral, we climbed trees, we get white man from skateboarding. Where are these activities that are consistent for our children? Because it's translating now into poor choices as adults.
Mhm.
So I just wanted to put that plug, and thank you so much for keeping mentioning the importance of exercise and movement.
Yeah, it's
Yeah.
important. I mean, if you ask my patients, I write something called an exercise prescription for them, so they
Yes,
understand exactly what I mean. It's not enough
that's
for a
right.
healthcare practitioner to tell the person, "I want
That's
you to
correct.
exercise." What does that mean? I have to write it out. In the same way I
Yes,
write a prescription, it means that this is what your heart rate should be
that's right.
for this many minutes, for this frequency per week,
Yeah,
so that they understand exactly their targets. Because you have to give people targets that they could achieve and they can measure.
that's
And
right.
I mean, it's the same
That's
for
right.
kids. Yeah, we have to give them some targets, and it's sad because there's something called social determinants of health.
Yes,
Like for example, in Trinidad, the crime situation is what often changes things, right?
yes,
How many parents are comfortable to let their kids do what we used to do in the 80s? you
yes,
know,
yes. So
and
true.
you've gone for hours and you even know where it is, and in
Yeah,
Trinidad
so,
now,
so true.
so that too is a function of the
Yeah,
society we live in. But I mean, as parents, you have to find a way to make your
that's
kid,
right.
active.
Even at
And
the school
sometimes,
level, many schools stopped PE.
yeah,
Those sorts of things.
it's very limited. Yeah.
Yeah, they don't see the value, so it's really an interesting conversation that we could really go into
Yeah.
a lot of depth in. Somebody messaged me, people sending me messages on WhatsApp,
Yeah.
and
So,
asked for you to just talk about erectile dysfunction and the link to
right.
diabetes and so.
Okay. Right. So, the same way we have blood vessels that around our heart, so we know about cardiovascular disease and heart attacks, and that's because the arteries around your heart, they get clogged, plaques that form, high cholesterol, and all of that, right? That's not the only place in your body you can have plaques forming. So when you get a stroke, that's a brain attack. I tell people consider a brain attack because it's the
Yes,
same process. Plaques are forming in the arteries leading to your brain, and then a clot happens, and then the blood flow is suddenly gone, and then you get a stroke. And
yes,
you can also have the same process going on in the blood vessels that supply the penis, and that is
yes,
a big factor. So um, erectile dysfunction is associated with obesity, high cholesterol, diabetes, and diabetes by itself. Then, if it's uncontrolled, will affect the nerves that govern the erectile process. So there is a massive link, and again, that's a later consequence.
right.
Um, if you have diabetes or high cholesterol that is causing erectile dysfunction, that's like an end organ problem, you know.
Yes.
That's mean that is many years that's passed. And but for Trinidad men, that's often the trigger, unfortunately, that they will go ahead. Right? They ain't playing with their business. If they're working like they wanted to work, they go land up by the doctor and they want
That's right.
testosterone tests. But what they really need
Hmm.
is cholesterol tests and sugar tests and thing, you know.
Yes.
But I mean, however they come to office, I'm glad when men come. I just hope that more of them come, because it's important, because too many of the things are silent. So
Yes.
erectile dysfunction is, yes, she's very right. It is a clearly linked condition to diabetes and high blood pressure and high cholesterol and all of that. But it's a later consequence. It's a later
Yes.
consequence. Yeah.
So we mentioned it a little bit before, but let's talk a little more now about that organ that keeps us alive, that beating heart. And
Mm,
we mentioned the heart attacks becoming more and more common,
yeah.
especially now our younger men. And again, quite possibly definitely related to lifestyle and eating and the drinking and the combination of the punching and the Red
Hmm.
Bull and those sorts of things. But what are warning signs that every man should know
Hmm.
that may say, listen, this is a yellow or red flag, something's happening
Mm.
on the inside.
Um, so we tend to only think that a heart attack is basically chest pain. That's a classic scenario, right? You can get heart attacks or heart pain, and it doesn't have to be chest pain. You can start to get pain in your jaw, for example, or pain in your
Mm-hmm.
shoulder, you know. Um, you can start to have heart problems where you get more shortness of breath than the chest pain per se. Especially if you are diabetic or you don't even know. Diabetes affects the nerves that cause you to feel pain. So a
Yes.
diabetic can have what we call a silent MI, a silent heart attack. They have feel no pain whatsoever.
Mm.
They're suddenly dizzy and start to feel short breath and they don't know why. But because they don't feel pain, they think it's not a heart attack.
Yes.
So for men, I mean, and patients in general, uh, heart disease and heart attacks, yeah, the chest pain is the most common, and that's a chest pain that usually is associated with some sort of exertion. You walk up a step or
Right.
something. But again, in some patients, it's not associated with exertion. You could get it when you're sitting down.
Mm.
So, I mean, I have too many patients that think that the pain is gas, right?
Yes.
And because if they squeeze it, their belt and say, well, it must be gas,
Mm-hmm.
I think it is too common. It is the number one killer wound, right? And so we just
Yes.
need to be able to investigate more people, especially men, because the female hormones protect females from heart disease
Mm.
up until menopause. So they don't have the same risk profile as men, certainly
Yes.
at least not, before menopause. So men are higher risk, they simply are, and we need to treat men differently when it comes to things like cardiovascular disease. We need to be more aggressive and get them in earlier so we could
In
pick it up.
earlier. So
Yeah.
again, we're gonna tie it up again, coming on to the end. However,
Mhm.
what age should I start checking as a dude?
Right. So long ago, you would say 50,
Mm-hmm.
times have changed. Obesity
Yeah.
is too prevalent. Sedentary lifestyles are too prevalent. Smoking is too prevalent. Alcohol, which is a cardiotoxin, people don't really know that it's a cardiotoxin. Um, it's too prevalent. All these are very well known risk factors for heart disease, and they are becoming more prevalent in our young men. So 50 years old to
Mm.
start screening
To
for things.
start
So I
screening.
would say men should be coming in when they're 30, at least to get a first
Yes,
screen,
a baseline.
and it's different if you have a family history,
Right.
if you know you're overweight or obese and you know you're a smoker or something, right? um but I would say that's a good baseline where you get your baseline and you can see, okay, well, cholesterol
Mm.
is, and the doctor can advise you on your risk, and then we go forward and say, okay, every 5 years or every 3 years or every year. But certainly when
Right.
men get to 40, 45, I think annual has to be important.
I'll give on.
Yeah, unless you're very healthy and your numbers perfect and you haven't changed your lifestyle, maybe we might go every 2 or 3 years, but you don't want to leave men too long. Yeah,
Correct.
yeah.
And even with that, and we're talking about these silent killers, because I had a patient who is actually the husband of a doctor. So he was doing
Mm,
his regular yearly checkups, had his ECG done, and
mm,
she saw a little blip. And he said, "What's that?" He said, "Nothing, worry about. Maybe the machine shifted," because it was
mm.
so inconsequential.
Right.
But he said, "You know what? Let me be a little anal." And the next day he went to the cardiologist, and he had 290% blockages.
Today I had that conversation with an employee, right? And he's saying, Doc, I could walk a half hour,
Hmm.
so I wouldn't have any sort of blockage. I said, no, that's not true. You can have up to 70% blockage and have zero symptoms, and you
Zero
will live in your
symptoms.
normal life playing cricket, playing football, right?
Wow.
That's how well our bodies are designed to have that reserve. And it's only when you get to 95 and so then you might
Yes.
start to get pain, because the body often will kind of form little tiny, parallel branches to kind of take up the slack. So
Yeah.
you don't have to have, people assume that, oh, well, I'm not feeling pain and I could walk up the stairs
Mhm.
good. I can't have heart. No, 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 no. And then a lot of heart attacks actually are not because it slowly goes from 70 to 80 to 90 to 98 to 99. What happens is you have a plaque and it may be blocking 70-80% of your artery, and the plaque ruptures. And then a
Yes.
clot forms and blocks the other 20-30%, and that causes the heart
Yes.
attack. So it's not a matter of whether you get pain or not. You need to really go to your doctor and get some proper assessments done.
Assessments.
And that goes back to the cycle, back to the same thing. You cannot wait for symptoms.
That's right.
I know many people who play in football all the time, and I say, "Oh, how this man dropped dead?"
Yeah.
I say, "Well, his
Yeah.
cholesterol is high," and I keep
Mhm.
asking him to go and do some tests or whatever, and he just not going because he ain't getting no
Not-
pain, and he gets a heart attack, and they want to know why. Because he's in his 50s and he's been having
Yeah.
this for years, and he's not really doing something else to figure out exactly what's happening.
Mhm. And we're
Yeah.
seeing even elite footballers. I'm trying to remember which club right now.
Mm-hmm.
Of a guy who collapsed again a few months ago. This is his second incident. I don't think
Mm-hmm.
they will let him play again. And didn't know that he had a cardiac issue. I was surprised that they put him back on the field.
Mm-hmm.
And actually, looking at some of the articles, he wasn't doing checks even at this elite level
Yeah.
where they're supposed
It,
to be
it
providing
it
certain
is.
care.
Yeah. I mean, that's a different type of heart disease than the heart plaques and stuff. But yeah,
Yeah.
that's something certainly that does exist. And you do see it in that stereotype where, a well-known athlete or something just suddenly drops dead and
Mm-hmm.
collapses. And we saw it in, I think it was a World Cup or Euro Cup, one of the
A Euro. A Euro Cup.
yeah,
Yeah.
and man, just drop down on the field, and
Mhm.
and it happens in elite athletes. So, but that's a different kind of heart disease. But you would think, yeah, that elite athletes would have all their checks done, and I guess
Yeah.
the same thing. It's the same process. Maybe you can't force them to go do the test because they're feeling good.
That's
It's
right.
it'd be the same thing. Yeah.
And just today, my brother sent me, it's so good to have these conversations, a video clip of Michael Johnson. Remember the
Mhm.
runner? And he had a massive stroke. And when they did
Mhm.
his scans, it seems as though he was having some TIAs. So let's
Right,
talk a little bit about that, about stroke.
right, right. So, I mean, like I said before, stroke is basically, I call it a brain attack. It's the same process as a heart attack. It's long term, high blood pressure, high cholesterol, altered blood sugars, and they predispose to plaque formation in the arteries to your brain.
Yes.
And then something happens and a clot forms and it blocks off flow totally, and then you get a stroke. Some people are lucky to get the TIAs, which is what sometimes we just call it a warning stroke, where you get stroke-like symptoms or mild symptoms, but they disappear within 24 hours. And then, some people have that and still not go and get a proper check. Not
Mm-hmm.
everyone is that lucky. So it's the same process as heart disease. You need to be able to go and do your test so you could pick up your risk factors.
That's right.
That's that. There's no signs that I could
Yes.
reliably tell somebody, well, look for that, and then if you had risk of a stroke, because the things
Yes.
that cause the stroke are silent things that happening for years, many years, many
And
years.
my youngest stroke patient right now is 38, and
Mm-hmm.
all because of lifestyle. Nothing
Yeah,
else.
I've
Poor
had heart
lifestyle
attack.
choices.
I've had people in the youngest I had as a DMO, and this was long before the vaccine. I talk about 2009 or whatever. I had in 2009 or 2010, I had a 28-year-old case I was called to see. Lifestyle, it was clearly the problem. When I spoke to the family, I went to the home. He was on his third heart attack at 28, 29,
Wow.
right? And his lifestyle was going to the river and making cook and drinking and
Hmm.
eating and, horribly overweight. And yeah, we abusing our bodies from way earlier.
Yeah,
Yeah,
from way, way earlier.
yeah, yeah.
I wanna somebody has asked a question and I want to keep them engaged and so happy. Thank you, Mr. Roberts, Errol Roberts. He's fixed all my ACs. If anybody need AC fixed, there's just a plug inside there, known as the Iceman in points. And he just wanted you to say something about the effect of falls in senior men, especially men over 60. What?
Ah,
Yeah, I think we could do a whole show on that. Mr. Roberts,
yeah, and remember I talked to you about a guy who wanted, right? So it's
yes,
a very important topic. Yeah. So separate from the chronic diseases, there's something called getting older. And the medical term, sometimes we call it senescence, where as we get older, when you do not take care of your body or the muscle mass and your bones and your flexibility, that causes so much sickness and morbidity.
yes,
And we allow ourselves to slow down and we don't focus on, and even sometimes as medical practitioners, we focus a lot on the cardiac and the aerobic exercise, and we
yes,
forget to tell them about strength training
yes,
and how important strength training and balance training is. You know a lot more than that. So, but for elderly people in generally, preventing falls is one of the most important things that a
yeah,
practitioner that you could do. And it doesn't just involve controlling pressure and sugar, it also involves your strength of your muscles and the integrity of
yes,
your bones and your ligaments and the balance. So we have to actively start now as practitioners to also include that as a standard thing that we getting people to
yeah,
exercise and strengthen their muscles and focus on getting healthy sources of protein so that their muscles are supplied with good nourishment and that they're flexible and they pay attention to their flexibility, because that is a common thing. They're losing muscle mass, and therefore they can't stand as they
right,
used to. They can't, and then they hardly walk in because they can't stand, and then they lose flexibility in their ankles and their knees or whatever. So that's our whole process. And it's a process that we sometimes allow because we allow ourselves to slowly get older.
hold
I mean,
on.
getting older is inevitable, but we could age well if you
That's
focus
right.
on your strength and stuff. So we need to focus a little more, well, a lot more, I think, on strength and strength training and mobility and stretching and all of
Correct.
that for people. Yeah, very
And
important.
that is why we are here as physios. So people, y'all are hearing Doc talk about it. He's one of the proactive physicians, but we are in a culture where sometimes we're not as proactive. We tell patients, well, just take a walk. When they're getting older, let them rest. The older we become, the more active we need to stay.
Need correct. You need to. You had to
Yeah,
be. You have to really push it, right?
that's right.
Because old age does make it difficult to maintain your muscle mass,
Yes,
and as you get older, your sense of taste drops. So therefore, food don't taste like it used to. So you only want to eat a toast and a tea. But you had to
yeah,
force yourself to get that protein and to exercise and maintain your mass and your muscle mass
yes,
and your bone mass. Because when you fall and you break something, it's real hell to get them back to normal, if at all. That's something we terrified of as doctors. If old people fall and break bones, it's
yeah.
real
Because the
trouble.
reality is and this is worldwide, once you're 60 and over, within 2 years, 50% of patients who break a hip, they die.
They die. They die.
That is just the
They die.
reality that has remained
Mm-hmm.
the same for
Mm-hmm.
years
Yeah.
everywhere in the world. First world, second world, third world, it doesn't matter.
And I
And
know this
so,
is sorry to cut
sorry,
you. I know this is a program for men, but for just a
yes,
plug for ladies and their bone
yes,
health. I mean, it does
yes,
affect men too, but osteoporosis, and before
that's
you get to
right.
osteoporosis, again, osteopenia,
Also,
that is something that happens long before, very early, even before menopause. This is not something for 70s and 80s.
that's right.
All women before menopause should do a bone density scan
That's
before they
correct.
go through menopause to get like a sort of baseline to see, because once you go through menopause, that's when things start to happen with your muscle mass and
Yeah,
your bone mass. So
bone
just a
mass.
plug for women, start doing that
Yes.
much earlier, please.
Thanks for the
Please.
reminder. I have to do mine this year. I put it off, but I need to do.
Yes.
I have to do mine this year. And
Yeah.
Doc, just to let you know, we have somebody from Denmark online.
Woo.
Hi.
Hello.
No, I just seen the face. I thought he's from Denmark. I know this person. This was one of my patients, but I think it was the Christian Erickson. That's correct. Thank you so much,
Yeah,
4G.
yeah, that's the guy. I
Yeah,
don't know if it's
that
the
was
World Cup or
him.
World Cup,
Yeah.
but he collapsed. He collapsed. Yeah, yeah.
I just got excited there thinking I had a viewer from
Happens
Denmark,
to
but
them,
I
right?
was like, hey,
Yeah,
soon will be global. Soon will
yeah,
be
yeah, yeah, yeah.
global.
No problem. You would. Yeah, yeah, yeah.
Somebody had an interesting question, and let me just show it on the screen. Is Bell's palsy considered a stroke?
No, I wouldn't consider that a stroke.
Okay.
That's basically one of the nerves that supply, part of the face really. Yeah, that had an infection or something, and therefore it temporarily becomes paralyzed, and that's not a stroke, no. And in
Good.
fact, doctors are trained well, are supposed to be trained, and I think most of us are. We well aware how to differentiate between a Bell's palsy and a stroke.
That's right. Correct. And if it happens, don't treat yourself and tell me you're putting a
Correct.
nutmeg in your mouth.
Don't
Go to
Google
the
and thing.
doctor.
Go and let your doctor figure out and make sure that it is Bell's palsy and nothing
That's
else.
right. Yeah. We have another question. And Dr. City time already 7:15, and we still, in the meet.
Yeah,
Thank you so much to the viewers participating and still listening to us. Remember to share the live. Great information here. Rajiv Jaglal saying, "Hi, Rajiv. Haven't seen you in a while." And his question: what about arthritis developing after ACL reconstruction, knee surgery? And again, we see more ACLs in men. Can you touch on that?
Well, yeah, men are obviously more active, well, generally, and they like to play. They're strong, and they like to jump from tree and all kind of mad thing, right? And play football. They play football, but then they watch World Cup, and everybody feel them as Zlatan. Everybody feel them as Zlatan or Messi, and want to run, and then they bust away the ACL, right? And when you rupture something like that, it's difficult to get it back as strong because we don't have the kind of people are not going to spend the amount of time that elite athlete, for example, will have to fix back that and then go through all the therapy to get it back.
Correct.
And then if you have an ACL damage, and even when you repair it, the joint may not be as I mean, I'm not an orthopedic doctor, but therefore the joint may not be as aligned as it used to be. And once there's some sort of a misalignment, you're gonna have more risk of early arthritis. So if you break your ankle, it's likely that you might develop arthritis earlier in that joint. So any kind of major injury, I think, to your joints, especially any joints in the lower limbs, your ankles and your knees and your hips and stuff, it does predispose you to arthritis.
Yes.
Of course, the ways to prevent that is, you get treated early. You go and do your therapy, and the therapy is to help strengthen back all the ligaments and all the muscles that help that muscle align your joint. So you want to make sure and maximize that, so that you could go back to being Zlatan and Messi or whoever you want to be, Haaland and all these fellas. Yeah.
And you're hearing Doc talking about your therapy. Your physiotherapy is not somebody who's telling you to walk from point A to point B. Your physiotherapist is somebody who trained to prescribe.
Stacey, I have patients who have major injuries, and I say, okay, it's been 3 months. How many sessions you had? 2.
Yeah.
I say, you had 2 sessions in 3 months?
Crazy.
Well, yeah, doc, I know exercise to do. I say, no, you don't. Because your therapist will assess you all the time and tell you when to, increase the load or do this. You're not trained to do that. You're hampering your recovery. Yeah.
Thank you for that, Doc. I'll give you a quick example. I mean, we could talk all night, but I'll give you a quick example as to why physios are valuable in the healthcare team, and we are often underestimated. So many patients who are diagnosed with diabetes, they are told, make sure you walk 30 minutes a day. That is excellent advice. However, it is more than that. If we're looking to control diabetes, that patient, and to prevent the complications of diabetes, that patient must be engaged in cardiovascular activity, such as your walking, your cycling, your swimming. They must also have strength training to maximize and build muscle to convert.
Especially the big muscles.
That's right.
Your thighs and your bottom, the bottom that men like bottom in Trinidad. The big muscles.
That's right.
They have an important role. So I tell my patients now too, it's not just about the cardio. If you had something and you worry about your sugar, do 10 squats. Do 10 lunges. Activate your thigh muscles and your gluteus muscles, because those help a lot to drop your sugar. Right?
Correct.
Your big muscles,
So as well as, I'll give you, this is one of my favorite examples. It happened to a patient a few years ago. He was told to go in the gym. Go in the gym without never going to the gym before, with a well-intentioned trainer. This person had uncontrolled diabetes, who had a lot of eye issues. And they had a retinal detachment because they were doing activity bending below the waist. Because of the diabetes, the effect on the retina and the bending below the waist, the retina detached, and they tried to repair it. It was never repaired. So
Yeah.
it's not that I want to see patients. One of my colleagues is on. Bianca, good night. She's here enjoying advice. She said, coming from her two favorite people, Dr. Bianca Lutchman, who works at Allied, one of my colleagues and good friends. Um, and we don't want to see all of y'all, you know. That's why we're talking about prevention. But if you
Yeah.
are diagnosed and you want to be well managed, you need to seek advice and guidance from an experienced physiotherapist who will also include your trainer, if you so desire, in your
Mm-hmm.
treatment plan and your management plan. So thank you again for making these plugs.
So,
So I want to go into an area that sometimes is a little taboo for men, especially Black men. We don't like to
mm.
talk about it. The prostate. Some people say
Oh,
the prostrate, our prostate
prostrate. Is he
problem
prostrate?
is,
No, yeah, yeah. Is he
if it's the
prostrate?
prostrate, it means you're kneeling down, lying down on the ground to Jesus. If
Wherever
it's
they
a
call it,
prostate,
whatever they want to call it, fine by me.
tell us.
Once you know what we so prostate is particularly in African men. African, I mean, we're not the same, right? So African men have a higher risk profile compared to East Indian men. East Indian men still have a high profile, but African men in Trinidad, for
Yeah,
whatever reason, whatever genetics are there in the population, they have a higher risk. So I advise men, I think even from the age of 40, you should be doing what we call an annual PSA. That's a prostate
right.
antigen test. That's a blood test. If you're feeling funny, you don't want the doctor do the thing that you don't want him do, well, at least do the blood test now. Do some,
That's very good.
don't just say afraid and I don't want to go. You are a patient. You have rights to your body. If you don't want that particular examination, that's fine. But at least let the doctor counsel and tell you what he can do or what
That's
she
right.
can do, so that we could get something done. Because if we do your PSA levels annually, we could track it, and it's important to track it annually, not do it once and then 10 years later you come back and
That's right.
so yeah, we could do that. There are things we could do, right? And but have a conversation with your medical provider so they could
That's right.
understand what you're feeling, what you're afraid, what you don't like. We could work with it. That's our job.
That's
We're not beasts. Most of us are not beasts. We will work with you. Yeah.
correct. And
Yeah.
somebody just messaged WhatsApp again. Does frequent urination always mean prostate cancer?
No, no, I would not really include that as any other kind of warning signs. Prostate cancer, again, is one of those silent ones. By the time you get symptoms of prostate cancer, you've had that for many years.
Yeah,
So frequent urination is the first thing will come to my mind is diabetes or infection more than prostate
yeah,
cancer. So prostate cancer, there are no signs that I would reliably say to look for. You need to be screening yourselves with your medical provider early on. Yeah.
and does family history matter in prostate cancers? You know, some
Very,
cancers there's a
very
family
much so.
history.
Very much so. So when there's a family history, especially in a first degree relative, I just recommend you start earlier, even 35,
Right.
doing your blood test, because we don't know how much yet environment and the kinds of foods and the toxin in the environment. We don't know how much that contributes. So I am very, very cautious and hyper cautious maybe. So if you have a family history, I'm going to recommend, and not just for prostate cancer, for colon cancer too.
Yes.
Colon cancer, it's another very common cancer. And I do recommend screening. And the best screening is a colonoscopy. There's no getting around that. That is the best screening for colon cancer. You can do stool tests and all of that, but they're not as reliable. Blood tests for colon cancer, that's not reliable at all. I don't recommend
Yeah.
them as screening. The best way, men should be having a colonoscopy. And I think if your risk is categorized as average, and it's your medical provider will take a history and help you categorize that risk, maybe I would say 50. But once people have a higher risk or family history, yeah, I mean, from the age of 40, I would recommend people that
Yeah.
start doing colonoscopies. And then based on the result, you could kind of tell them, well, every 10 years or every 5 years.
Yes.
Yeah, it's a common one.
Excellent.
Yeah.
Someone has a question. An elderly person that they know, their tongue tends to swell from time to time, and the person needs to be urgently hospitalized to treat it. Doctors relate it to an allergy, but they're yet to determine what's the cause. The person's mobility is not affected, but they're wondering if it could be stroke related.
if the doctors are examining the person, they're literally seeing the tongue actually swollen and not just feeling swollen to the patient, then yeah, it does sound like an allergy.
Yeah.
And the challenges with allergies is often hard to find out what's the allergy to.
Yes.
Um, but yeah, if the doctors are actually seeing, and the term I think is angioedema, where the tongue itself just becomes very swollen. I mean, I would expect most doctors will know what that looks like, and
Right.
therefore, it probably does sound like an allergy. Of course, you need to do other tests and make sure you don't have risk factors for stroke, but it
Mm-hmm.
does sound like an allergy, at least just based on what they're saying there.
See, thanks,
Yeah.
Doc. So I want to go into oh, somebody just asked related to your colonoscopy question. Can
Mm-hmm.
you walk into casualty and ask for a referral to have a colonoscopy done? How are we going about to do the screening?
Trinidadians and Tobagonians, we abuse our casualty people, right? So I would not recommend that. The reason they call it as a casualty is it's for casualties, it's for accidents and emergencies. So
That's
we
it.
don't want to block it up. It's not because when there are accidents and emergencies, if you come in for a request like that, you will be sent to the back of the line.
Yes,
And if a next casualty comes in and a next emergency comes in, you're going to stay at the back of the line. So casualties are not meant for that. So you really need to access either your health center or your general practitioner for that sort of referral.
yes.
It is not really for what casualty is for. Yeah.
So we have another great question. Is it normal for men over 50 to wake up at night to urinate?
It
And I
does
guess that might
become
be infrequent, yeah.
it does become more frequent as you get older. Um, but obviously there are things that need to be ruled out when that starts to happen, and diabetes is one. And prostate issues is the next one, really. So those are the two main ones, especially for someone at that age where you need to make sure and get a checkup and some blood tests
Yes,
and examine to figure it out. Make sure you rule those things out before you can say, well, it's just you're getting a little bit older.
yes.
You can't just decide it's old age. Yeah,
Old age.
yeah.
Thank you for that. So, Doc, I think one of the biggest silent killers that we don't like to talk about is usually not the physical one, it's
Hmm.
men's mental health. And I know
Oh,
this is
yeah.
one of your areas.
Yeah.
Let's talk about it. Why do men struggle to ask for help? How does
So
stress and how does that stress affect your physical health?
yeah, so it links back, I guess, to the way we were raised, that men are taught, to be stoic and not complain. So there's a huge stigma. I mean, there's a stigma just for even checking your physical health, but there's a massive stigma for mental health. Um, so stress is a part of life. That's a no. The only people that don't have
Yes,
stress is people who are dead.
that's
So
correct.
stress is a part of life, but we don't want stress to overwhelm you. So men need to be aware that stress is linked to almost every disease that you could think of. Stress is a risk factor for heart disease. Stress is a risk factor in hypertension. Stress increases your cortisol levels and affects how
Mhm.
you gain weight and affects your sugar and all of that. So stress you cannot separate stress from the physical diseases.
Yes,
And your mind is a part of your physical body. So it's not some airy fairy thing that you need to pretend doesn't exist. Stress is real, very real.
that's correct.
And in men, stress does not present in the same way it would present for a woman, right? It could present as just being angry all the time or irritable all the
Mhm.
time. Men in Trinidad and Tobago are often taught anger is a way to express your emotions, but
Yes.
don't express it any other way. So they go get on bad, they go get
Hmm.
on stink, or they will go and drink
Mhm.
rum with their friends. That's the
Mhm.
only two things we know to do for stress.
Yeah.
But those are so dangerous. So stress in men is very different in how it presents, how
Mhm.
men perceive it, and in what they are prepared to do to deal with their mental health.
Yes.
So you have to attack it a different way. So you can't tell a lady might be happy to go on a yoga retreat or aromatherapy or do a spa day. You're not gonna find Trini men doing that.
Correct.
You have to find ways that you can get it because men have and research has showed us repeatedly that there are distinct biological, physical responses
Mhm.
to stress that are different in men than compared to women. So stress certainly affects your physical health,
Mhm.
and in men, I believe we have to frame it differently. The solution, so we would call it self care for women,
Yes.
Call it something else for men. Call it I mean, the label doesn't matter. You could say it's focus work. You could call it
Yes.
um mental conditioning. These things are used by NFL teams, elite athletes. If you ever read about the Black Mamba mentality that Kobe made
Yes.
famous, mindfulness and those things are part of it. You look at LeBron James. He's in taking a break during the play, and he's doing deep breathing exercises. If LeBron James could do it, if Kobe could do it, if
That's right.
Novak Djokovic could do these things and follow mindfulness and breathing patterns to deal with their stress,
Yeah,
why we can't do it in Trinidad?
that's right.
So we need to frame it better for men and talk
Yeah.
about it more so that we could find ways for men to deal with their stress because they have stress. It's different in how it presents in women, and we need to attack it differently. It's not the
Yes.
same thing. It's not the same thing. Yeah.
Somebody just asked, I'm going to show it on the screen for our viewers. Thanks, Mr. Charles, one of my patients. Thanks, Mr. Charles, for coming on. When should we be concerned about forgetfulness so
Mhm.
that we would feel, that we have dementia
Yeah.
and or Alzheimer's?
So absent-mindedness, sometimes we call it, as you get older, does become more common. Doesn't mean you have dementia. So I suspect when it becomes a red flag for me is when other people starting to notice it,
Mm,
right? That's the best way I would say that your relative's gonna say, daddy, mommy, but you just mentioned that.
yeah,
Those things are when you really have no recollection. So if you misplace your keys, well, everybody's do that. If you forget where you put your phone, yeah, we
yes,
do that. I wouldn't call that. I would say that's regular forgetfulness. But when other more important things where you're speaking to someone and they tell you, but we just spoke about that 2 minutes ago.
yeah.
Those things I would be you need to go and get a proper assessment, probably from a mental health professional who
Yes.
deals with memory, rather than a regular GP.
And thankfully through I think a lot of the work of the Alzheimer's Association in
Mhm.
Trinidad and Tobago, there's more and more awareness coming into play. So Mr. Charles or anybody who's interested in that, follow them on Facebook for sure. They have a lot of activities that occur, and you can also ask your doctor in the health center or your GP to direct you to the memory clinic. There are memory clinics
Yeah.
now, at least I know in Southwest, in San Fernando Gen. There are
Yes.
memory clinics that are doing some fantastic work for persons with signs of forgetfulness, and then they'll decide, they will assess you and determine if it's dementia or anything else. Yeah. So thank you so much for that. Someone asked a little while ago about, hi Darren, thank you for joining, Darren Dyer, and this is his question. Is the PSA test sufficient to use to judge the possibility of prostate issues, or should the physical test also be a part of your testing regime?
Ideally, we are taught that both are important. But in my practice, my 20-year practice in Trinidad men, I think it's still a barrier for some reason, doing the
Yes.
physical one. And then if you time the physical one improperly, doing a PSA a prostate examination, sorry, if you do it before you do the PSA blood test, actually it sends it up, it elevates it.
Wow.
Most doctors supposed to know that, right? So I mean, I don't think a doctor would do a a prostate exam, and then immediately
Then,
draw a sample,
right.
Um, but because of the stigma, um,
Yes.
I am comfortable saying that if I could get more men into the office just to do the annual blood test, I good with
Yes.
that. I good with that.
Excellent.
And even when I examine the prostate, I cannot examine your whole prostate with my finger. I could probably
That's
feel
right.
the back 1/3 of it or something. So
Yes.
I am not going to ever put my head in a block and say, well, because I felt the back 1/3 of your prostate and it feels okay to me that you're good.
Yes.
I will always still do a blood test. The blood test is to me is something that we cannot leave out.
Mm.
If there's challenges with the stigma, fine. I'm comfortable to leave out the other one. If they
Yes.
have a problem, no problem. I'm not going to force you. But that
Excellent.
PSA blood test, I would do it every year. Yeah.
Thank you for that. So, folks, we can be here for hours on end, and I just want to start to slowly wrap up and to cement certain things that we've discussed today. And if you have any further questions, drop me a line, put them in the comments. I will get back to you through doctor. I'll have him answer for you. So this is not the end, but Doc, let's imagine that all our viewers here are men and
Mm-hmm.
all of them just celebrated their 40th
Mm-hmm.
birthday
Yeah.
and or they're over 40.
Right.
He feels healthy. What health checks should he schedule tomorrow?
Tomorrow, well, you go to visit your doctor, and what that doctor is going to do, they're going to check your basic parameters. So they're going to check your weight, they're going to check your BMI, they're going to check your waist circumference. That's important. Sometimes we forget that. So where the fat is in your body is important. So they're going to check your waist. Um, they if they have the scale, and hopefully they do, they could also check your muscle mass and that kind of thing. But it's important as well. They will check your blood pressure, they will check your blood sugar, and then they will take a history and all of that and get a risk profile really, where they can kind of estimate the risk of certain things. And then based on that, they will do the physical exam, and then they will go on to certain blood tests. And if you're 40 and up, I mean, cholesterol is mandatory, blood sugars are mandatory. I will do PSA, your blood count, and these things. And then other tests again that may pop up depending on the risk that the doctor uncovers. Um, Doctors are trained to assess your risk. So
Yes.
don't rely on yourself or Google to figure out, well, I think I good or whatever,
Oh
no.
my
Let
God, Dr.
doctor,
Google. Oh my God.
let your doctor do that, please. Let them
Please.
categorize your risk, and they could advise you what you need to do and what tests you need to do, you know?
I had a patient who went to Dr. Google complaining of chronic headaches, and she came with a file. I'm not exaggerating, I was pediatrician at the time.
I
A
know, I know.
file, and she diagnosed herself with brain tumors,
Mm.
small aneurysms. And I just took it and threw it in the bin. And she was in horror when she looked at her folder in the bin. I said, we're starting from scratch. And she
Yeah.
simply had cervicogenic headaches. She had a little arthritis in the neck.
Mm-hmm.
And with 5 sessions of physio, she was headache free.
Yeah.
So don't stress yourselves out. That is why we did the training. So you don't have to stress out
Correct.
about that.
Let the practitioners
That's
do
right.
their job.
Do their job.
You can't, I mean, bat in your crease. I mean, I gonna bat in my crease. I not gonna do
Correct?
Stacy walk. Stacy ain't gonna do my walk. Yeah, let
Definitely.
everybody bat in your everybody feel they could Google and be smart,
That's correct.
Yeah.
So, Doc, I just want to have just a minute segment where I'm just going to ask you some very brief questions. Some
Okay.
of them might be yes or no. Some of
All
them
right.
might be just very short responses. So this
Right.
allows us not only to get to know you better, but more importantly, to cement all that we have done. So you
Sure.
ready?
All right. Let me go. Let me go.
Coffee or tea?
Tea. I'm a tea man. Yeah. Coffee go
Morning
better for
person
me.
or night owl?
Night owl. Oh God. I'm a night owl. It's not, human beings are designed to be morning people, but some people are just night owls.
Yeah, but
I'm a
I'm an
night owl.
owl too.
Yeah.
What do you think is one of the biggest health myths?
The biggest help I still think is that we feel we are healthy as long as we don't have a symptom of something. That's the biggest
Yes.
thing. And that we
Yes.
rely on that. Only when I feel sick, then something wrong, I'll go.
Yes.
That's the biggest myth that we need to dispel. Yeah.
Most common excuse patients give.
Oh God, doc, a hustling. That's why they forget the tablet. Or hustling, that's why I didn't do this. Or they hustling. But that's when it's more important that they come and they're hustling. They're always hustling. They're always hustling.
That's right.
Yeah.
What do you think is the most underrated health habits?
A good night's sleep.
Yes.
And that's so much more important now with this sort of doom scrolling phenomenon where people going to
Yeah.
sleep, but they're going to sleep with their phone. So now
Yeah.
they're doom scrolling on that light in their eye there, and you're going to bed 10 o'clock, but you're going to sleep
Yes.
half 12 because you're just
Yes.
sleep.
I'm guilty
Sleep.
of that.
Sleep is, I mean, we all are, but I have actually started to look. If I want to play a game or go to Facebook, I'm doing it when I'm in the living room, and
Yes.
I'm not going. I'm taking that phone and I'm turning it down and I put it on my bed and I'm going to sleep. And it's
Yeah.
helping me sleep a little bit better. I fall asleep quicker and I feel a little bit more rested and I can get up
Develop those
earlier.
habits.
Yeah, it's a
Good
dangerous
habits.
habit. Sleep is how your body recovers from everything and repairs many things.
Yeah.
Sleep is important. Yeah, very important.
One thing every man should start tomorrow.
I actually think that because I'm so particular to stress, recently, I think men need to double check the kinds of things that they are prepared to do to see about their mental health. And I
Yeah.
think they need to look at mindfulness. And you
Yeah.
don't need to call it that. Look at some sort of mental health practice or mental conditioning. It
Yeah.
could be as simple as breathing exercises for 2 minutes.
Yes.
You know, mindfulness is not for soft man; it is for men who are smart,
That's
and
right.
it is one of the biggest things I think we could start adding to our healthcare regime. Research it, see what grabs your attention. I have men. In fact, the commonest way for men to grab mindfulness is mindful physical activity.
Yeah.
Mindfulness basically just means you're in the moment, and if you're doing an exercise, it's a repetitive exercise, but you're focusing on how the exercise, what the sensations that the exercise is doing. You're focusing on your form in the gym. You're focusing on how you breathe, and it becomes a mindfulness exercise. And you're
Yes.
not you're locking out what's happening on your phone, or you're not macroing what the lady's saying on the other side of the gym. You're
Focus
mindful,
is
being mindful and present in what you're doing.
yes.
Any repetitive activity can become a mindful exercise if you let it,
Yes.
and that's, I think we need to figure out how to incorporate some of that into our lives.
That is fantastic. I'm going to give you the opportunity, Doc, just 30 seconds
Hmm.
to give us maybe your final takeaway message or messages for all our men who are viewing and all the
Hmm.
women who love them.
Men are different. There's a book, I think, Men Are From Mars and Women Are From
Women
Venus.
from
It just
Venus.
means we are different. Men and women are different. We cannot approach the problem the same way. Um, we have to figure out ways, I guess, to get our men into the doctor's offices, because most of these problems are silent. And if you
Yes.
wait for symptoms, you're often too late. So I think the main thing, and maybe men just need to really just be accountable and start doing it, but you just have to find ways to get into that doctor's office earlier and let the doctor do their job. Let them do their
Yes.
job. Yeah.
Thank you so much for this, Dr. Pararam. Tonight's
So, so
conversation really reminds us that strength isn't about ignoring your health. As you're
correct,
talking about,
correct.
this strong man mentality, this is strength,
Mhm.
not ignoring your health.
Yeah.
Real strength is making that appointment. Real
Yeah.
strength is making sure you get screened. Real
Yeah.
strength is protecting yourself so you can continue providing for yourself and your family. So, on
Mhm.
behalf of Dr. Pararam and myself, thank you so much for joining us on this first episode of Real Men, Real Health, Real Conversations. Today is just the first, and we're going to have so many more episodes coming up. It is supposed to be 4. I think it's going to be more.
Gonna be
All
more. I
of
feel it's
them
gonna be more.
watching this, and all that we ignore men for too long, and this
Mhm.
is our opportunity to embrace you and your opportunity to take control of your health and wellness. So next Wednesday, I'm proud to say that we have a point 14 doc in the house, Dr. David Richards, Pumpkin Vine family. So he said yes as well, but he is an ENT. He's also a health and wellness advocate. And we will be actually not just looking at the typical ENT things, we're going to be delving a little more on sleep. And I know, Mr. Roberts, you asked a question. You're going to get it answered. So you have to tune in next week to get that answered. But Dr. Pararam has already led us in this direction. So just
Mhm.
remember, until next week, Wednesday, 6:30, right here, your health is your greatest investment. So take care of it before it demands your attention. I'm Dr. Stacey DeGale here, your faith physiotherapist on Real Time with Dr. Stacey, and I will see you very, very soon. Don't forget to share this to some dude, some brother, some uncle, some father, some grandfather. This, if you had to pay for it, you wouldn't be able to. So make sure you share it and take control of your health. Until next week, Wednesday at 6:30, where we'll join with Dr. Richards about ENT issues and focus on sleep and wellness in men. See you then.
Good night, everyone.